All right, so I return once again to discuss the ever so growing scam that is the American healthcare system. This time it's an article from The Intercept that's giving us some really great information, really important information that everybody should take heed to because this may shape healthcare in this country, or it most likely will in the very near future. So, Medicare privatization scheme based legal questions about profiteering. This is amazing. This article here, as many other articles and stories do, just gives you the full outline of American healthcare in a nutshell. So I'll read you a little bit of the beginning of the article so you can get an idea, and then give you bits and pieces of it. I'm not going to read the entire thing; it's pretty lengthy, but it really tells you what you need to know. So, in the final stretch of the Trump administration, government attorneys expressed ethics concerns about a Medicare privatization scheme being set up by Adam Bowler, a former dorm mate of Jared Kushner's, who was made director of the Center for Medicare and Medicaid Innovation, also known as CMMI, or the Innovation Center. In January 2019, ahead of the launch of a new direct contracting model, the Office of General Counsel for the Health and Human Services Department warned in comments on a draft of the proposal that it appears as if the new project was being set up to benefit specific companies. We are concerned based on Center for Medicare and Medicaid Services regular references to organizations like Chin Med, Oak Street Health, and Verily in the comments and otherwise, that this model has been designed with specific private sector entities in mind. If accurate, this could create ethics concerns, as the creation of this model would give those entities a leg up in the market. Read the guidance, a copy of which was obtained by The Intercept. The direct contracting model was announced publicly in April 2019 and began its implementation phase in October 2020. The project pays private companies a predetermined but individualized amount per year per patient, regardless of what the company spends on care, and has persisted and grown under the Biden administration. Wow. So what I want to do here is I want to skip a little bit further down. Like I said, I just want to read to you the beginning of it so you get a quick idea. And now I want to just give you some more information. So the payment model is designed to be lucrative for firms contracting with the government. The government pays a set amount of money annually per patient based on a risk score that is easily gained by the healthcare company. And there is no requirement that a minimum percentage of the money be spent on care. Take note of that. There's no requirement that a minimum amount of the money be spent on care. Take note of that. So they can say, we'll spend this much on care and we'll take the rest of this. That's absolutely amazing. A requirement known as a medical loss ratio that is typically used to constrain insurance firms or providers from eating the bulk of the funding. That's exactly what they're doing. The latest privatization scheme echoes the Medicare Advantage system, the private insurer-run version of Medicare, currently used by over 40% of enrollees. Direct contracting uses a model that, in theory, pays firms for maintaining the overall health of a patient rather than billing Medicare for individual medical services. Critics argue that the latter model, which is currently used for standard Medicare enrollees, incentivizes unnecessary hospital visits and treatments. But the former model, which is referred to as value-based contracting, requires complex bureaucratic oversight to ensure that providers are not juking the system by unreasonably inflating the cost and difficulty of caring for a patient. Diane Archer, founder of Just Care and a health policy expert, described a similar scenario in an email to The Intercept. The way they make money, and this is a quote, is by spending as little as possible on patient care while ensuring as best they can that they have all diagnosis possible for their enrollees in order to maximize government payments. The more diagnosis, the higher the government payments. Government payments are set up front and unrelated to the cost of number of services people receive. The incentive to deny is to deny as much care as possible. And yes, the incentive is to deny as much care as possible, she continued. It's also to delay as much care as possible and to create administrative and financial barriers that make it hard for enrollees to get care. Even if the DCE does not delay or deny care, she said, referring to direct contracting entities approved to participate in the program. Aside from the looting of public funds and the depreciation of care, the shift towards privatization has profound implications for the political economy of healthcare. Every new private equity or venture capital backed firm that grabs a bigger piece of healthcare market becomes an incumbent corporate stakeholder and a well-funded obstacle to public-minded reform efforts. This is absolutely amazing. This is a scam. It's an outright scam. So what we have here is this new thing. Well, it's not a new thing. It was started under the Trump administration. It's being continued under the Biden administration. But it's called the direct contracting model, where essentially, as far as I understand it, you have these private companies that are using through the means that they can to get a leg up in the market, to receive money from the government, these subsidies or whatever, and in order to make money or more money, it's profiteering is what it is. They can deny care, and that's what they do already. It's what they do anyway. Now it just seems they're doing it on a much larger scale, and it's this privatization of Medicare as well as Medicaid, and this seemingly has deleterious effects going forward. Look, man, not much needs to be said about this. Our healthcare system is a scam. We need to nationalize absolutely anything and everything to do with healthcare, because this is what you get when you try to privatize it and you leave it to the profiteering assholes. Healthcare shouldn't be something where you should be worried about profit. No, you go to the hospital, you get care. Notice how in that article, the people or the corrupt healthcare ghouls and criminals were saying, oh, we're worried that people will take unnecessary hospital visits. Think about that for a second. You're worried that people that are insured will take unnecessary hospital visits, and thus we'll have to pay for it, and we don't really want to pay for it. What we want to do is deny care so we can save money. Guys, we should be able to live in a society where you go to the hospital, you go to the doctor, whether or not you feel like something is really wrong with you or you just have a slight cough. You get care, you can leave, and you're not given a bill. I mean, that should be the norm here. That's the most basic, simple necessity that any civil society should be granted. But here in America, our corrupt politicians and people that run the healthcare industries, Big Pharma, all the rest of them, they don't understand it, and they never will.